Hi, it's Dr. David Greene, founder and CEO of R3 Stem Cell, the global leader in regenerative therapies. Okay, today we're talking about treatment for cerebral palsy with stem cell therapy in Mexico. So, cerebral palsy has been one of the most researched conditions when it comes to incorporation of stem cells into treatment. And rightfully so. When you look at children with CP, there are zero disease-modifying treatments available right now. Basically, it's physical therapy, physical rehab, occupational therapy, things like that, but nothing to actually improve the problem in the brain. So children with CP suffer an anoxic injury either during birth or at some point after birth that leads to a lifetime of varying levels of disability, right? And there might be some surgeries that can help, fix some of the contractures, maybe some medications to help with spasms, things like that. But there really are no disease-modifying treatments until now with stem cell therapy. When you look at the outcomes of stem cell therapy for children with CP, they've actually been very good, and they've been replicated many times throughout the last 15 years of research. Research here in the United States has been done at Duke University. They've done 2 studies looking at either usage of autologous, meaning the child's own umbilical cord blood, or allogeneic, where they looked at a donor umbilical cord blood. And both times the results were excellent, with improvements being seen in gross motor function, like balance, standing, sitting capabilities, as well as some fine motor skills and cognition. But it was very important, they found a delineation between those who got a significant amount of stem cells versus those who got a lower amount. All right? So it's very important that the child receive enough stem cells to see those differences. And it's often not necessarily one treatment session that made that difference. So that with 3 or more sessions, the results were better. The Russia study showed that too. In addition, over a certain amount of stem cells, whether it was total nucleated cells with cord blood or a total amount of mesenchymal stem cells from umbilical cord tissue, both of them worked fantastic. All right? So these children do need a lot of stem cells, and it's going to be several treatments, but the results can change a child's life dramatically, and hence, the family. All right? So it's been very satisfying compared to anything else that's out there, because there isn't anything else out there that's really disease modifying. All right? So we have 2 treatment centers in Mexico. One is in Tijuana, just over the border from San Diego. It's in a beautiful medical high-rise. We will pick you and your child up in San Diego, take you over to the clinic, do the treatment for a day or 2 or 3, and then we'll bring you back. We'll pay for the hotel as well. All right? Our other treatment center is in Playa del Carmen, about 20 minutes from Cancun. Once again, we'll pick you up from the airport, provide lodging. The treatment center is very, very attractive. Both of them are, okay? So, for more information, visit us online at stemcellmexico.com. And if you scroll down on the homepage, you'll see this consumer guide. There's actually 35 consumer guides that I've written, but the one on cerebral palsy is very informative. It has everything I just mentioned, but actually lists the outcomes of those specific studies and the outcome parameters, like the GMFM, which is the gross motor function measure, the CAF, cognitive assessment, things like that. All right? And then call us to set up your free consultation at +1 for the USA, 888-988-0515. All right? Thank you very much.